Hi, everybody. This portion of our program welcomes two, excuse me, two other advocacy organizations, and they are both dear to our hearts, the MOG Project. And so what we wanted to do was we wanted to invite the Siegel Rare Neuroimmune Association and one of their patients that they have had connected to their organization who really got help from them. We also wanted to invite the Guthy-Jackson Charitable Foundation and have them do the same, bring a patient. And we have brought a patient of our own who's connected to the MOG Project. And I do want to shout out to the Sumaira Foundation. They couldn't be here today. We hope to have them do the same thing, but they also do some MOG advocacy as well. So I want to kind of start off by having each of us introduce ourselves. And I'm going to start with those who are online. And I see Corey. Corey, would you give yourself a quick introduction?
Sure. Good morning. So good to be here. I'm Corey Wolf, Director of Patient Advocacy for the Guthy-Jackson Charitable Foundation.
Thank you. And you've brought along Kim. Kim, would you like to introduce yourself?
Yes, I would. Hello, everyone. So I'm Kim Jackson Matthews, and I'm a patient with NMOSD, but also I am the Diversity, Equity, and Inclusion and Accessibility Lead for the Guthy-Jackson Charitable Foundation.
Thank you. And we have Gigi. Would you like to introduce yourself?
Sure. Hi, I'm Gigi DeFibri. I am Director of Research and Programs at the Siegel Rare Neuroimmune Association, or sRNA for short. And yeah, it's great to be here.
Thank you. And you've brought along with you in person here, Landy. Landy, would you like to introduce yourself?
Hi, yes, I'm Landy. I also have NMO, and sRNA was really impactful to me when I was younger, and I'm just really excited to be here.
Okay, great. And so now I would like to introduce Nancy. She's connected to the MOG Project, and you're a MOG patient.
I am. Hopefully this is on. Hi. My clinical name is Satakwan, and my other name is Nancy. And I was diagnosed in 2021, and I'm so grateful to be part of the MOG Project. It's amazing.
Oh, thank you so much. First, I'd like to, ask. I want to pose a question to the organizations, the leaders of the organizations, and I want to go through each one of you. And I would like to know, what does your organization do specifically for patients? I know that's a big, heavy lift and a big ask, but if you were to summarize that, tell us what they do for patients and how impactful that is to their disease. I think I'll start with Guthy-Jackson. Corey?
Yeah, thank you, Julie. So that's a big question to answer. If I could just give a little history of the foundation, maybe for some people that don't know Guthy-Jackson. Victoria and Bill Guthy started the foundation in 2008 after their daughter was diagnosed with NMO. And at that time, there was no FDA-approved treatments. Of course, Bill and Victoria went straight to Mayo Clinic, where there was someone doing research there, Dr. Brian Weinshenker, and they made it a mission to fund groundbreaking science and unite global experts to make the lives of patients and families better in the NMO community, not just for their own daughter. And we're very closely aligned with MOGAD patients because back in those days, we did not realize there was this other antibody. So we are the same family. We just, we're excited that you have this distinction now. And Guthy-Jackson helped to fund the diagnostic criteria for MOG patients today. And all these years later, 17 years later, we have 4 FDA-approved treatments for NMO. So I think that should give a lot of hope to everyone watching today. I mean, many patients are probably already in clinical trials for some of those same therapeutics, but the work beyond the research is what our team does. And we have a robust patient advocacy team. We we're here for patients and caregivers every step of the way, connecting families with expert clinicians, providing educational resources, and we facilitate over a dozen monthly virtual support groups, a few of which are hybrid or in person. We offer multiple programs that meet the critical needs of the community, and it's important that we encourage you to join these programs. Guthy-Jackson's programs are open and available to all MOGAD patients as well, from things like offering medical alert ID bracelets. We have an art and wellness program. We call it Artistry in Motion. It's online, virtual. We send you a free kit. It's a processed art, not like a paint and sip. So it's more focused on wellness, and it's led by board certified art therapist out of Jacksonville, Florida, Indigo Art Therapy. And more to come even in 2026. So stay tuned to those programs. We encourage you to utilize them as well.
Wow, thank you, Corey. I really appreciate that. Gigi, I'd like to hear from the SRNA. Same question.
Yeah, of course. So, like Corey, I just want to give kind of a summary of where we started and kind of where we are now. So SRNA, or the Siegel Rare Neuroimmune Association, was founded in 1994, actually as the Transverse Myelitis Association. So that was our name from the beginning. And it was founded by those diagnosed with transverse myelitis or with family members with TM, as there was very little info. The internet was just kind of getting started. There were no centers of excellence, no physicians that really, focused on TM to the extent that we have now. And so as time went on, people were coming to the organization with recently diagnosed with optic neuritis or acute disseminated encephalomyelitis. And so SRNA, or at the time TMA, always welcomed folks with these diagnoses with open arms. We didn't know yet that it was, NMO or MOG. And so as time went on, obviously, these were identified as folks with NMO and MOG. So now we have, 18 centers of excellence in rare neuroimmune disorders. I forgot to mention, we did change our name in 2019 to better reflect the fact that we work with people with more than just TM. So now we're the Siegel Rare Neuroimmune Association. We support people all over the world. We fund fellowship programs, research. We, like Guthy-Jackson, we have some joint support group meetings with them. We provide support groups, education programs, materials, family camp for those for children diagnosed with rare neuroimmune disorders that the MOG Project was a very generous donor of this past summer. And we work very closely with other organizations like the MOG Project and Guthy-Jackson. So really happy to be here, and thank you for asking about the organization.
Well, I thank you, Gigi. It's really great to hear about it too. I think everybody should connect to both of these great organizations. I want to turn to the patients who have been involved and affected by these organizations. And I'm going to start, since Kim is here online, I'm going to start with you. And Kim, you worked for Guthy-Jackson at this point, but that wasn't always the case. And I'd like to know what made you reach out, first of all, and also what did you find that was so attractive to getting involved with an advocacy organization?
Thank you. That's a good question. I've been asked many times now over the course of, now it's been 4 years. So 2021, my big attack came and found myself during COVID in the hospital. And a lot of people may know this story, but for those that don't, I decided, hey, I'm not going down without being, knowing exactly what this is. I had gone blind in one eye about 4 or 5 months prior. So the doctors didn't know. And I ended up having a vaccination that may have triggered this perhaps, and that was what I was told. But it was in the hospital. I was just, trying to figure out what to do. I decided to Google, which they say don't Google, but hey, with my mind, and told me differently. So I needed to find out in the first or second different organizations came up, and I saw Guthy-Jackson, which, Jackson is a part of my name. I said, that's it. Let me call. It has to be it. That's the sign, right? So I called and was so fortunate to get a person on the line who was empathetic, who was so understanding of everything that I was going through, and who calmed me down to say that I wasn't alone. And that person happens to be Corey Wolf. And I could not, I said, this is it, because I'm getting all these, positives. And she just assured me, just, like a mother, even though I may be a little older, but like a mother, it's going to be all right. Don't worry about this. You go get home first, get home. And I know, good. I can, read about what and she sent me resources. And later, after I got situated, I looked at all the resources and all this, but fast forward, Corey ended up letting me know about one of the main programs, which was the PAC, Recall Patient Advocacy Council, that was starting up. It was just starting, and she said, "You might, I think that you'd be good for this." And I said, "I don't know anything, other than what I've been reading." And she said, "No, no, you can give your perspective and all of this." So with that, that's how I got doing volunteer with them, and it's been just wonderful being able to be in the beginning. The advocacy was first learning everything that I knew, just eating it up. I love to read, so eating it up, learning, so then I could eventually help people on whoever they would connect us with at that time. We connected with different patients, new patients, and that's what I did. And I thought, if I could be like Corey, better, giving, if not advice, but giving them hope. That is it, giving people hope. And because I've been doing that for years with other organizations that I've been involved with, or just me being me and helping people through homeless situations and all. And I'm still part of different other organizations that do that. And I'm like, wow, look at this. I couldn't do it alone. It's, especially now with this disease, but this is how things work, and I say how God works. This is me talking personally, since we're, stepping out. But I said, this is it. I didn't feel hopeless. I feel hope, because I thought, okay, it was at first it's going to be the end, but this is it, the direction. And then from there, fast forward, doing the work is important. So I was asked months or, into, the next year, if I would, eventually work with the team in advocacy. And I'm like, yes, I will accept this. Not even, looking for a job. And I said, hey, thank you. Thank you. This is the direction I needed to go in. And so since that, you just heard me in the beginning introduce myself as diversity, equity, inclusion, and accessibility. I made sure those two things were important to me for rare disease, for us. We just need so much, and it's worth fighting for. And I've been listening to our patients, and I can go on and I won't, but listen so much. And that's what I've done for the last few years, to what their needs are. We always ask. And I was fortunate to also help start a women's support group. And it started with me and someone else, and then just me for the last years. And now I have a co-facilitator, but it has expanded to not just one a month, but we've been able to expand to 2 times a month because of the people that we're serving and via our Zoom. So that's it in a nutshell. But advocacy is extremely important to me.
Wow, Kim, thank you. They're very lucky to have you. We've had the pleasure to get to know Kim, and she does a bang up job there, and we're honored to call her friends of the MOG Project and friends of ours. So,
Yes,
thank you.
Thank you.
Thank you. I'd like to go next to Landy. Landy, I'd like to pose the same question to you because you were originally connected to more than one organization, and now you're really working for the Siegel Rare Neuroimmune Association, or the SRNA, I guess we could call them. Could you tell us a little bit about what led you to connect to the organizations, and then what led to your eventual position at the SRNA?
Yeah, absolutely. I mean, to preface, I was a pediatric NMO case, which is kind of a rare bird. I mean, I don't have MOG, I have NMO, and I was like one of the only people that had it. I really didn't have anyone that I could look to and say, hey, there's another person my age that is doing well. Most of the people that I did know were not doing well. And I felt very lost at the time. I was just a really scared kid. And so, when I did get my diagnosis, there was exactly 7 articles. If you looked up NMO, there was nothing on the internet, nothing you could do about it. So my mom was like, hey, you have this symptom of TM, which is, transverse myelitis. And she was able to find the TMA. And she was like, oh, this is an organization that represents TM, not NMO. But my mom was able to contact them and be like, hey, my daughter would love to go to summer camp with you guys and be able to meet people that are like her. I know it's not the same. I know that, her stuff is different, but we'd love to just be able to have her have proximity to younger people that have a rare disease like that. And so that's how I got connected with them, because my mom emailed them and they were like, yes, please come to camp with us. We want to meet your daughter. We want your daughter to meet our kids. And I wasn't the only person that had a diagnosis other than TM. There was one other girl that had AFM, but it still is a really rare bird to have pediatric NMO. I did also get to interact with Guthy-Jackson as a child. I do want to say that because they were the main NMO organization. And that was the first time I'd ever met an NMO patient, was getting to go to one of their original patient days. They were a really great org for NMO, but I was really needing proximity to kids, if that makes sense. So I'm really of the opinion that, hey, you should get connected to as many of these groups as possible, because a lot of them can be better in one area than another, or they provide you with a full coverage for your mental health. So all of them have a lot of good merit. But anyway, I went to that camp and it kind of changed my life because, my mom was able to meet with other moms and they were able to talk. My mom was able to talk to doctors and say, hey, my kid is going through so much pain. What should she do? What should she be on? And I was eventually prescribed baclofen. I had been going without baclofen that entire time and having terrible pain almost every night. I couldn't sleep. I couldn't think. I was having just the most miserable quality of life. Having gone paralyzed, having gone blind, life was just kind of a mess. But it was after talking to those doctors and talking to other kids my age that I had a real life turnaround, and things started to look up for me. So I was able to connect and go to summer camp every summer, and I grew up with the organization, and I started volunteering for them when I was around 15 or 16. And now I'm 23, and last year I got hired by them to work for them, write their magazine, do the little things, do community programs, all the fun stuff, all the stuff that I've been desperately wanting to do and that I had been doing in some capacity as a volunteer. So I was just happy to be here and happy to do that.
Thank you, Landy. Everybody, I tell you, I had just met Landy, and we were talking on the phone while I was driving on a long trip, and we had such a long talk. It was lovely, and so I'm honored to really get to know you, and I think what you've done with the SRNA is so good. She's an example of why we need to connect to our youth, and the MOG Project is starting to do that with some of their programs, and for those we have a couple of new programs programs that are really helpful for kids. We have a Children's Ambassador program that's for patients who are children, and we also have a Youth Champion program for siblings, friends of patients who want to just get involved. We realize that this organization needs a future, and bringing those youth up into teach them how we advocate, and hopefully they'll take the baton one day and be advocates for the MOG Project and all MOGAD patients themselves, and these other organizations as well. So thank you, Landy. Finally, I would like to introduce Nancy. She is connected to the MOG Project. She sits in my support group and has for probably 4 years now, but she's I don't want to, she's a tough cookie, and she's also a tough case. And she's one of the nicest, most lovely people I've met in this advocacy that I've done, or ever. And so, Nancy, could you please tell us what led you to, get connected to the MOG Project, and how it changed your disease management, your life, in any way that we could, you could think of.
So of course, what first leads us to the organizations is we get a diagnosis. So by the time I was diagnosed, I was fully paralyzed in my lower body. I had weakness in my upper body. I had optic neuritis in one eye, moving into the other eye. Nobody knew what was wrong with me. Luckily, I have to go through an Indian health service because I'm Tlingit Indian. And so one of our neurologists had worked with MOG patients at the University of Washington Medical School in his residency. I had every symptom of MOG except seizures. And so he was pretty certain that that's what I had. But like we've heard from other people, they had to rule out all infectious diseases, MS, all its related diseases, and all cancers. So I had to have full body MRIs to rule out all cancers. It was at the height of Omicron, so a blood test was sent to the Mayo Clinic, but it took a while to get it back. And I had a very high titer level. So even before we got that blood test back, the night the infectious disease specialist came in and said he had ruled out everything, and they'd ruled out everything else. That was at 8:30 one night, and I was like, my paralysis was moving up into my diaphragm, and I knew if it got there, I'd have to be vented. So it was terrifying, And they started me on IV steroids. And when we did get the blood test back and I got a MOG diagnosis, like I could still barely move. It's like, what do you say? And he's like, MOG. I'm like, spell that? And it's like MOG. I said, okay, I have to Google that. I don't know what that is. So it was either my daughter, who's a pharmacist, or my sister, who's my escort with me today. They found the MOG Project online. And because we didn't know anything about it. I mean, what the heck is MOG? You get that diagnosis and like, we don't know what that is, and it's really terrifying. And you hear that it's a, very rare neuroimmune disease. It's not curable. You don't know what's going to happen to you. In the short term and the long term. And so I actually emailed the MOG Project. And this woman is amazing. She's amazing. She emailed me back and said, can we do a phone call? And so we did, and we talked for about 3 hours. I mean, she was explaining MOG to me. I was answering all these questions. I mean, she was so patient and thorough, and I knew so much more about MOG, and she was explaining to me, where to go on the website and, what to do, and about the support group, because I'm 70, so I needed to be in the support group for us older folks. And since that time, I mean, both her and Andrea and I, we've gotten really close and become friends. But without the MOG Project, I wouldn't know anything about MOG. I live in a very small island community of 8,000 people and 14 miles of road from end to end. we do have the only hospital in Southeast Alaska, big hospital, but nobody there knows anything about MOG, and so without the MOG project, honestly, I don't know if I'd be alive, really and truly, because I have to advocate for myself. I bring research studies into my doctors all the time, if they don't know stuff. There's just no information. I'm the second Alaskan and the first Alaska Native to be diagnosed. And that at last night's pizza party was the first time I've ever met anybody in MOG in person. So we've done the Zoom meetings and support. And it was so amazing to meet everybody in person, and the hugs were long and wonderful. But the MOG Project provides, so much information, support, a family. I mean, it's incredible the way, to me, that it brings together, those of us who have MOG, these amazing medical professionals and researchers, here today, Dr. Flanagan and Dr. Chen, who really are interested in learning more about MOG and helping us patients. It brings together families, friends, research, the studies. I mean, there's so much, and it's growing all the time. Even in the 4 years that I've been part of it, it's growing and growing, and it's not only national, but it's international. It's really neat in our support groups where, we have people from Germany, South America, Australia sometimes. I mean, it's incredible. And, when you get this diagnosis of this rare disease and you don't know anybody else, you've never met anybody else, you've never heard of this disease, it's pretty lonely. You feel really alone, and it can be really scary sometimes. And, I'm still not fully stable, so it's this kind of uncertainty with it. There's good periods, there's more challenging periods. How bad are the challenging periods going to get, or how good can the good periods get? And the support group is one place where we get to learn from others. We learn from each other. And so the MOG Project brings all of us, these people, together in ways that really make it possible for us to advocate for ourselves, because when we have these diseases, we didn't hear a lot about it in the previous panels, but when I was first going, they put in my chart actually that I was making symptoms up, and so it was really hard to get my ER to finally take me serious, and my sister and daughter and a friend who was the former hospital administrator had to insist at this visit that they not release me, because I probably would have died if they had. And they finally did a lumbar puncture and found white blood cells in my spinal fluid and took me serious. But until then, they wouldn't, And since that time, when I go into the ER where I live, I won't go actually anymore unless I literally feel like I'm dying, because they say, we don't know what to do with you. We don't know about this disease. What'd you even come in here for? Because we don't know what to do with you. And, I don't go in unless I can barely walk or get out of bed. And so, hearing that is really difficult. And, one thing the MOG Project has really helped me with is learn how to advocate for myself. We really have to learn to advocate for ourselves. We really have to learn to, when we encounter medical professionals who are not as wonderful as the ones here, that, we lead them to a better understanding of MOG, and even, Julie's so wonderful. There should be more Native people, Native Americans, Alaska Natives, Native Hawaiians diagnosed with MOG. So there should be, we figured out probably about 10 Alaska Natives diagnosed. Well, I'm the only one. So that means there's, misdiagnoses going on and undiagnosed. And so, I was sharing this with Julie, and her immediate response was okay, when you get stable and you feel better, like we can work together and do outreach for all the Indian health services in the United States. And I said, yeah, that would be great. Not only the facilities and the primary doctors, but the ERs, you know, we can do stuff. So, you know, I'm really hoping when I get more stable, you know, I mean, that's the way the MOG Project is. You know, I mean, Julie talked about them expanding and doing more things, you know, earlier. But, you know, she's open to doing all kinds of different expansions and you know, really moving forward this understanding of MOG, but bringing together all these people, you know, the medical professionals, us patients, the caregivers, you know, the kids, us old folks, you know, like everybody. And we've become this like incredible family together. I mean, to me, this is like so amazing. Look at this wonderful group here, the one online. I mean, this is incredible. And this collaboration between the Mayo Clinic and the MOG Project, I mean, it's so exciting and wonderful. And I know each one of us, you know, it's so comforting and just empowering to be with each other and to hear each other's stories. And, you know, those are the kinds of things that the MOG Project gives us. It's like really, I don't think I would be alive without the MOG Project. I truly do not. And so I'm so grateful that we can't remember if it was my sister or daughter found the MOG Project, but you called me like right away, and it was like, you know, when I was still in that state of confusion and didn't know like what does this mean. I mean, I'd never thought of I never imagined myself getting paralyzed or anything like that, or possibly going blind. I mean, it just never occurred to me, you know. So thank you. Oh, thank you.
That was Andrea. She said, "We love you, Nancy," and we do.
So in my Thinkit language, Gunoshish.
Oh, I have trouble saying it, Gunoshish.
Yeah.
I've been practicing. It's a very hard language, I will say. And thank you, Nancy. It was, beautiful words for us. You know, everyone here, I think what you said is, I think, resounding through all the organizations. I mean, every one of these ladies here has, you know, the similar stories and just their resolve to do for others in the way that they you know, have been doing for the past many years. MOG Project hasn't been around as long as some of the others, but they do provide a model for us and those in the future for what we can do to come together. And, you know, I know we've heard from everyone. I want to just go around the room one more time just to give a quick thought from everyone as to you know, what I think what we want to know in just a short little blurb, what would you say to others about connecting to any and all organizations for your disease? Corey, you want to start?
Sure. I think we'll probably all have similar sentiments, but connecting to as many people as you can be really pivotal in your journey. I know even for myself, I remember the first phone call I made. My daughter was diagnosed when she was 15, and we were feeling like we were alone on this dark path. Nobody understood what was happening, even though we were in a great hospital with good doctors. We just felt very disconnected. And once we found community through multiple organizations, it was definitely different for my daughter, just like Landy was saying, because she was younger, she needed to connect with people her age. I needed to connect with other parents. And it has literally changed the way, it's changed her resilience, and it has changed our family's dynamic, because it was we felt so much more included, and we had a sense of belonging. So, and I know that everyone that's in that room today, and during the breaks and hugging and getting to know each other, I know that you know that feeling very well. So thank you for doing this, Julie.
Oh, thank you, Corey. Thank you so much. And thank you for what you do. Kim, what would you say?
Yeah, similar. It's just great to not just be with one organization, because I'm still learning what, you know, even today, you know, making some notes. to get back to, some people and the network in ways that I have questions so that I can help other people, but also myself, like I said earlier. But it's just so impactful, just listening to the other stories and seeing if I have something, to add or distract, from, like I said, from what those people have brought or said even today, like so many stories. And so just like closing yourself off is just, it's not a good thing. It's just like when you're studying something, you need that other perspective and also to continue learning. Like in the beginning, when I first went to the first patient day and learning and meeting these people that are doing so many things, and it's given me encouragement to, learn about what, MOGAD and learning from you, Julie, and learning from and meeting uh, um, Andrea and James, and it's just like a whole family, really. And we get out the box of being here, so I say the box, but this virtual, and then you see each other in person. It's like, yeah, coming back like a family reunion, and who wouldn't want that? Even if it's not a bad thing, if you're alone or by yourself or you're single, hey, who wouldn't want that? And that's what I want. I still look for it, besides the fact that, I'm married, but I brought my husband along. And so now he's a part, and it's not like he's just, they say a caregiver. He's like, I don't see myself, like that. That's not the title. But look, people looking for him more than they're looking for me, because he is how he has, gotten in here and, you say collabs or met people along the way with things that we've been asked to do as couples and all of this. So I just say, please consider reaching out or coming to our all, supporting people, just all, supporting us as leaders, or supporting us as people who are hosts or facilitators of or support groups or something. You could just come in and listen, and you don't have to have your face shown. That's what I tell people. We don't need to see you. Maybe just listen. Maybe there's something you could take away.
Thank you, Kim. I just, that is so well said. And of course, your husband is a personality that we just love. So thanks for giving him a shout out. And thanks for all you do. Gigi, what would you say? I know that I just want to point out that what sticks in my mind is the SRNA's Stronger Together, the campaign that they always say. But you go ahead.
Yeah, thank you. So I echo everything that Corey and Kim said. I think there's no negatives to reaching out to all of the organizations and going to different programs and events and support groups. And all of us offer, I think, the ability to just pick up the phone and call someone and have someone answer when you're in that kind of panic mode of either being recently diagnosed or having a relapse or something going on. And there's something just so comforting about knowing that there's just someone on the other line who isn't going to be like, what are you talking about? What is that? Like someone who understands and knows. And so I think, just reaching out to all of the organizations. We also partner together on different things. And so we're, a big family, and it is wonderful to also get together in person and see each other. And
Thanks, Gigi. Absolutely. I always love getting together with the SRNA events. Are very, very good. Everybody should connect with them. So I'd like to go to Landy and to hear your thoughts.
Honestly, there's so many reasons to connect to all of them. I think the number one thing is a lot of them do different regional events, do different in-person opportunities too. And hey, if there's something in my region, there's something in, I can drive there in 2 hours and it's an event where people are going to be like me, why not go? I want to see people. And that's the hardest part of having these diseases is sometimes really the loneliness and the isolation. And I love the support groups and I love doing the online stuff, and that's, good. And I think being as part of all of those across the board is great too. But the possibility of going to go see my friends, go see my people at these conferences is worth its weight in gold. It's so worthwhile to be able to be in the room with the people, being able to see people. It feels real all of a sudden, like that the people are really impacted by this, and that I'm not alone. I'm looking at people's faces. I'm looking at people's stories and seeing my own reflected back at me, and it's a sensation of connection that. It's amazing. I always recommend going to in-person events if you're able to, if it's accessible to you, all that kind of thing. I also think that across the board, these are organizations that are run by people who have been, either personally impacted or, they know somebody with it. A lot of these organizations are full of people that are dealing with the same issues. They have the same heart as you. People like Julie are very important. They're champions of your cause because they understand exactly what you're going through. SRNA is much the same way. Guthy-Jackson, much the same way. It's really important to have people that are in your corner, but also understand fully the extent of what you've had to go through.
Oh, thank you so much. That's so well said. Thank you. Nancy, what do you say?
Yeah, and I want to start by saying I've worked with both Guthy-Jackson and SRNA. The art things are like amazing, and a kit should be arriving to my house soon for the next art thing. But I would tell people, don't hesitate. Reach out, like as soon as you find the organization or find out about them. And a lot of people these days with their diagnosis, they're Googling. So they're finding something fairly quickly, and like others said, there's, with these rare diseases particularly, there's a lot of like a sense of isolation and just kind of loneliness and so much uncertainty. You don't know what your future's going to be like. They're not curable, so it's not like you can take an antibiotic and 10 days later you're fine. It's very different, and it's life-changing. I live alone, so it's totally life-changing for me, but for my family and friends as well, and, like, we've been able to, through the MOG Project, I can speak most about the MOG Project, it really does provide a family. It's a sense of comfort. I love our support groups. I mean, I look forward to them all the time, and I'm usually one of the oldest there, or the oldest. So, and I have kind of a complicated case, so sometimes when I ask questions, nobody has tips for me because nobody's going through what I'm going through. But I learn so much every meeting. I mean, I just, enjoy and look forward to them, each month, because we learn from each other. And I mean, even recently we had somebody come in who was recently diagnosed in the weeks earlier, and she was crying, and you just you remember so clearly those moments, when you were first diagnosed and how scary that was. And I was so grateful that, she came to our support group soon after her diagnosis. And, the support is there not only as soon as they find the organization, which is usually fairly soon after a diagnosis, but I'm 4 years in, and there's, it's ongoing. And so, as our life changes and our health changes and what's going on, the organizations are there, helping us, providing information, bringing us together. Julie helped me connect me to Dr. Flanagan and Dr. Chen because, I got kind of a weird mock thing. And, it's like, it's just ongoing support and love. I mean, you really feel like, you talked about it, just the love between all of us, it's so much fun meeting everybody in person. And I mean, we hugged each other for I don't know how long, and same with Andrea, it's like, because we had never met each other in person, and it's just wonderful. I would urge anybody who's thinking about it, or getting a diagnosis to reach out as quickly as possible, and it'll be life-changing.
Nancy, thank you so much. Those are such kind words, and that hug was a good one. It was a good long one. Lots of squeezing.
It was.
Yeah. One last thing that I'll say before we close is there is another reason to get involved with an organization, one of the organizations. And some of the organizations, MOG Project does it, is research. We do research through surveys. And those surveys of the MOG community inform researchers, they inform industry. We have done surveys with the help of a lot of the medical centers, and certainly 2 surveys with UCB, who is here they're waving their arms in the back. Those surveys are presented at really great conferences like ECTRIMS, and they inform everyone of the idiosyncrasies, the patient experience, and everything about MOGAD, and that makes it different from some of the other rare neuroimmune conditions. And this community of MOGAD patients has been so generous with taking that survey and getting involved, and the advocacy organizations can facilitate that. So that's the last thing I'll say about it. And I want to thank everyone who joined. I mean, we love you guys. We're all very close, and I can't thank you enough for supporting this first patient summit of ours. I'm so excited that you guys came. Thank you. Everybody give a round of applause for these lovely ladies.